Tonight, the CDC is now recommending fewer routine vaccines for children and is raising questions for many parents.
Yeah, our Randy Hildreth joins us now in the studio with what doctors are saying and what families should know. Hi, Randy.
Yeah, good evening to you both. So the first thing for parents, the new guidelines significantly reduce the number of vaccines recommended for all children. We went from protections against about 17 diseases down to vaccine recommendations to protect against 11 diseases for most children. Also, it's not clear how widely the CDC guidance will be adopted. Tonight, the Maryland Department of Health said they plan to keep following guidance from the American Academy of Pediatrics instead. The criticism has been swift and sharp. The American Academy of Pediatrics released a statement saying the CDC's new vaccine decision is, quote, dangerous and unnecessary. The Infectious Diseases Society of America called it, quote, a reckless step. The CDC announced Monday it was overhauling the vaccine schedule and recommending fewer shots for children. The guidelines will still recommend vaccines to guard against about 11 diseases, including measles, mumps, and chickenpox. But other vaccines will be recommended for high-risk groups. The agency says immunizations for things like the flu or hepatitis A and B will be decided by parents and their child's doctor. The CDC says the new schedule follows vaccine guidelines from peer nations like Denmark, where fewer shots are recommended. Health Secretary Robert F. Kennedy Jr. in a statement said, quote, this decision protects children, respects families, and rebuilds trust in public health. But leaders with the American Academy of Pediatrics warned the U.S. shouldn't follow other countries because our vaccine recommendations protect against diseases with known impacts in America.
You can't just copy and paste public health, and that's what they seem to be doing here.
Dr. Sean O'Leary sits on the Infectious Diseases Committee with the American Academy of Pediatrics. He says their vaccine schedule is rooted in decades of research, and leaders say they will continue to publish their own recommendations.
No scientific reason to believe that Denmark's vaccine recommendations are safer. What we do know is that anytime a child goes without recommended immunizations, they're at risk for these diseases that we can prevent.
Now, Health and Human Services officials said insurance providers will continue to cover the cost of all vaccines. In the studio, Randy Hildreth, WUSA 9.
Parents are likely going to have lots of questions for their doctors after all these changes.
Yeah,
Randy, thank you.